The Appropriations Subcommittee on Labor, Health, and Human Services, Education, and related agencies will come to order. I'm certainly pleased we could have this opportunity this morning, Dr. Collins, to talk to you and the other Institute directors about the work you're doing and the work you'd like to do. Certainly every family faces health concerns during their lifetime, and there are so many things that can be done by NIH that I think can't be done as well anywhere else. A new drug, a new device, new treatment can take anywhere from a decade to longer to develop, can cost billions of dollars on occasion with a pretty high failure rate, even when you think you're on the right path. Certainly, it's necessary for the federal government to invest in biomedical research. It represents the hopes of lots of people and lots of families, and particularly now as we see conditions growing as people survive heart problems and stroke problems. We see more people with Alzheimer's and cancer challenges. We see the potential for designer medicine, largely because of the great work that was done to figure out how to define and understand the human genome system in a better way. This year, this committee's subcommittee and the full committee have placed a high priority on this research. We've got planned for and have a bill that includes $2 billion of extra money for that research, an increase of about 7% over current year's spending. Over the past decade, with not much new money going into NIH, the purchasing power at NIH has decreased by about 22%. We hope to see that reversed if we're successful with what we're trying to do to provide the increase that we're looking at here. These are clearly difficult budgetary times, and I'm sure we could spend a lot of this hearing talk about how there should be more money for other things in this budget, and there's a disagreement on that in some cases and an agreement on some cases that if we had all the money in the world, the priorities might be a whole lot easier to achieve. But I look forward to hearing from you, Dr. Collins, from your team that you brought as we talked about this morning. I specifically said, can you bring some of the people that we haven't seen lately who are very much focused on the individual areas of research so we can get a greater sense of understanding what the potential is, what the needs are, what is out there that you're seeing and begin to see, and also the challenge of young researchers having a research grant approved are dramatically less than they were a decade ago, and I'm sure that that's a topic we'll want to discuss as well. How long do young researchers stay in research if they continue to have their ideas not allow them to move forward? So those are all things we want to talk about today. We're glad you're here. I want to turn to Senator Murray, who's a big supporter of your work as well, for her opening statement.